Well, our next speaker is Dr. Leah Mandler. She has a PhD in political science and is the research associate at the School of Political Sciences, University of Haifa, Israel. And Dr. Mandler will be presenting, Do You Trust Your Neighbor? Coronavirus Resilience and Social Cohesion. Dr. Mandler, thank you.
Thank you, Elena, and thank you everyone for having me. It's really a pleasure, and actually it turned to be very coherent, the fact that I am presenting after Professor Krasnov, who mentioned two of the topics that I will be also talking about. One of them is trust, and the other one is coronavirus crisis. So I will just share my presentation so you can follow me more easily. Just a second. Okay, here we go. Okay, so I am currently involved in a research with my colleague, Dr. Carmela Lutmer from the University of Haifa. We are working together on gathering the information about the coronavirus resilience and the capability of the countries in different parts of the world to cope with the challenges that the recent pandemics has presented to different societies. And what we are asking is actually what makes one society resilient to COVID-19 crisis and the other one not. And what are actually the determinants of the capabilities that the governments are using in order to cope with the problems that this pandemic has brought to different countries. What we are assuming, and we spoke about trust in the last presentation, is that basically the more the people trust their governments, their friends, their neighbors, everybody else in the country, they will be better equipped to respond to the problems that the pandemic is bringing. And currently we are starting a small comparative case study comparing 3 countries, Israel, Spain, and South Korea. Basically, each of them is from different parts of the world, one from the Middle East, one from Europe, and one from Asian countries. We are planning to extend this to more countries in the future, but currently this is the project underway. So before we start talking about what makes one country resilient and the other non-resilient, first we have to understand what is the social resilience. What is this capability of a state to stand in front of a disaster or a problem or a pandemic and face it and face it successfully. So when we go to the literature says that the ability of a country to be socially resilient is an effective mechanism for overcoming adverse situation. As you see, this definition is very wide. It is something given, it can be given to interpretation. It depends how you define effective mechanism. It also depends how you define adverse situation. But basically, we are relating to natural disasters. That is the things that countries could not have prevented before. They could have been ready for them, but they couldn't have prevented them. So the big questions resulting from this definition is whether this is evaluative or descriptive definition. That means is the capability or the social resilience to meet those problems something that can be evaluated and be also evaluated between different countries, or is it something that we can only describe and say this country is resilient and the other is not? Also, there's a question of whether it is a process or a result. Is it something that we will be able to analyze at the end of the pandemics, or is it something that we can analyze during the pandemics and see how it develops? And also there are 2 more questions. One of them is the question of adaptivity. When we say effective mechanism for overcoming, do we relate to something that makes a country adapt to new conditions? Or do we actually analyze how well is this country staying the same that it was before the problems that it was presented to? And finally, and those factors are more psychological than actually social, we are asking the question whether these are internal or external factors that make one society resilient and the other non-resilient. What we have chosen is actually the definition that is evaluative. It is a process. That means that we are looking into it over the time. It's internal because we don't have any control of external factors, and it actually speaks about adaptivity of a system, the ability to cope with the problems of pandemics successfully and change accordingly to what challenges the pandemics is presenting. So when we look again into the disasters literature, we see that a resilient society has all those factors. I will not have the time to go with you through all of them. Just take a look and you will probably see that from each and every line, you can see that, that all those criteria actually speak about some kind of trust. Because if I have trust, then basically I can network with other people and gain the returns that I trust that I will receive. I can also get the social support that I need from my neighbors. I'm capable of improvising and being creative because I trust that other people will appreciate my involvement and my creativity. So all those indicators basically speak of trust. This is why we are analyzing trust as one of the main indicators of social resilience in a country. And when you look at what the governments around the world have been doing ever since last December, that is ever since the COVID-19 has been present in our reality, we can see that most countries are doing the same things. If you look at the figure here, you will see the dots and the lines connecting them. So the dots are basically, the size of the dots will tell you how many countries out of all countries are doing those things. And the lines are connecting those types of coping one to the other. So as you can see, most countries are doing social distancing, travel advisory and restriction. It have been influencing their monetary policy, and more countries are also caring about the patients, helping the health facility, etc. But some of them are also changing their social security policies, not many of them. But also, this is one of the things that the countries have been doing. So when we look at those things that the governments have been doing in order to be resilient, in order to cope with the pandemics, we can ask ourselves how efficiently they actually are doing. Why is one country more considered to be more efficient and the other country less? So I'm not taking credit for this research. Somebody has done that before us. What they have done is actually gather all the data from all the countries that they are reporting about the interventions that governments are doing regarding COVID-19. And they have found which government measures are more efficient, so they have better results than other measures that governments have been doing. And as you can see here on the list, I will not go again through all of them because we don't have the time, but basically the things that have found to they have found to be most effective are small gathering cancellations, closure of educational institutions, and somebody in Israel should hear that because they are opening that all over again. Border restriction, and if you take a look, you can see that actually police and army interventions are between the least effective measures. Okay, so countries, they're different in how they are coping with this pandemics, not only in how much they're being involved into citizens' lives, but also which type of measures they're choosing to actually help this to help their citizens and to cope with the pandemics. So there are many ways to rank countries and to say this one has been successful and the other is less successful. We are using several of them, but as you can see here on the list, most of the researchers agree that the best way to measure how effective one country has been in relation to the other is to measure the number of deaths, the number of people who have been contagious with the disease, the number of agreements that this country has for purchasing the vaccine, and also some indicators that have to do with the economics, the way that the country has been able to mitigate the economic problems, economic activity, that unemployment and lack of resources for the society. So these are basically the criteria according to which we can rank countries and say this one is more effectively meeting this pandemic than the other. So here is the list. You can take a look and see where your country stands on the list of international efforts to meet the problems of pandemics. We are looking only at these three countries: South Korea, as I said, Israel, and Spain. Spain is on the 41st place, Israel is on the 21st, and South Korea is on the 4th best place in the world. This ranking, of course, is not it's not 100% precise. It's accordingly to the criteria that I mentioned, but there are other criteria where I believe that the states will be positioned a little bit differently. Nevertheless, we do see that there are significant differences between the three countries that we are comparing. So let's take a deeper look into those things that we have mentioned that are important. One of them is the case fatality rate. That means how many people have died in relation to how many people have been contagious. So we again see that Spain is in the worst place, South Korea here is second, and Israel is in the best place. This is updated until November 22nd. So it also includes the second wave of disease around the world. Here we can see the cumulative number of people who are confirmed with COVID-19. We see Spain again on the first place, Israel second, and South Korea has the least people contagious. And the daily new confirmed patients, how many people have been contagious with COVID-19 every day. Here, as you can see, because it's updated to the almost the recent weeks, we see the second wave in Spain even being worse than it was the first time, also in Israel, while the South Korea remains more or less stable. But we can see that they had their peak in the beginning of the contagion. This is very important because we will see what government has done and what are the differences. I will just run quickly through the rest of the graphs because I think that the data is basically available, so you can also download it from the internet. The number of tests, as I showed before, it was the highest in Israel, and also it was the lowest in South Korea, which is interesting because we tend to think that the more the country is testing people, the more data it has, and then it can cope more efficiently, which is unfortunately not true. And here on this graph, you can see the restrictions, the severity of restrictions that countries have implemented. I don't know if you can if you see those numbers closely, but you can also see according to the periods, we see that Israel has been the strictest among the three countries, and Spain has been very strict in the beginning and less so at the end of this period. And what is interesting is that South Korea has been the least strict among the three countries, but it has done the decisions have been staying there for longer times. That means that if South Korea made a decision to make a lockdown, then it was there for 2-3 months or 2-3 weeks at least, and then the other period of opening up was also longer. So it's less zigzagging, it's less changing the decisions that the country is making than compared to Israel and to Spain. They make decisions for longer periods of time, which is maybe because why they're more efficient. Okay, so what we are measuring as the independent variables, the cause for the difference between the efficacy of one and the other government is the trust. And we have two indicators of trust. One is a trust in government, And trusting government refers to the share of people who say, yes, I do trust my government to do the decisions that it needs to do. Unfortunately, the data for trust in government and trust in other people is not available for 2020. I heard that there is some gathering of data, but right now it's not available for research. The latest data that we have on trust is from 2018 on government, and somewhere between 2011 and 2017, it's not the same for every country for interpersonal trust. But here in the graph that I will show you in a moment, you will see how many people say, what percentage of the people says that they have confidence in their national government, and the capability of the government to make and to actually conduct the decisions that the government is making. That means that not only to say that they will do, but also to do them. So here we are, again, comparing the three cases that we are looking into. We see that Spain Spain's citizens have the least confidence. They have only 28% of people trusting their governments, as compared to Israel, which here in 2018 had the highest level of confidence in their government. If we look at the whole graph, we will see Greece on one end and Switzerland on the other end. And you can see that the differences between countries are very, need to be considered because they're very significant. The other determinant of trust that we were looking into is trust in others. And here it's a bit problematic for analyzing because it's self-reported in a trust index. That means that people were asked, how much do you trust others, your neighbors, your friends, anyone else that you will meet in your country, and whether should you be careful in your conduct with those people or not. So this index is a kind of combination of the people's answers to those questions. But this survey has been carried out in the last time it was carried out, it was in 2018. And here again, you can see the difference that the higher level of interpersonal trust, although as you probably remember, South Korea was not so high on the level of trust in the government, but the highest level of interpersonal trust is in South Korea. The lowest was found in Spain, and Israel is somewhere in between. It was also somewhere in between in COVID response. So we do find the connection between the two things. We also, because we are measuring them in the difference of time, so we also can see that they're connected. But this is just a preliminary research, so we have to see that on more countries and to go deeper into data. Probably we will be able to obtain some more updated data. Hopefully something that has to do with 2020, but this is these are the results that we have right now. So just to quickly summarize is why do we think that interpersonal trust is more important than the trust that people have in their governments? Government also includes the police and other part of executive branches, etc. There are three main reasons. First of all, we believe that the effectiveness of any medical treatment that people need to receive depends on the level of trust. The ability of people to get tested, their desire to be treated, their willingness to go to the hospital and to listen to what the doctors are saying depends on the level of trust that they have in other people, that they happen to be doctors, but in any way, people who live in the same country with them. At the same time, the ability of citizens to receive the decisions that the government has brought and to stay at home when they need to put their masks on when they're asked to, and also sacrifice their freedoms of different kinds in the time when they are losing their jobs, forced to teach their children from home, and all the other things that we have been challenged to do during this pandemics. All those things that actually depend on the level of trust that I, as a person, have towards everybody else that I am in interaction with. And basically what we need to believe is that the people that we are surrounded with and other people in our families and out of our families, they have our best interest in their mind. They think about us, and we can trust them, and we basically need to put our lives in their hands. So I will leave you with a question. If we have proven, and if we have actually the proof that trust and social resilience and effective ability of the government and the state to cope with pandemics or any other disaster for that matter are related, and they're actually causing each other, and this is a cycle that is currently closed, how do we, or how does anyone, even government, break the cycle, and where is the capability to change, to become more effective, to provide more trust, and to become more resilient? So thank you very much. I would like to hear questions if you have.
Thank you so much, Dr. Mandler. That's a wonderful presentation. Well, there is one question. It has to do with vaccination about, this is from Ulya Grekova, about compulsory vaccination and how to manage that, and the right of any state to demand that the vaccination for coronavirus.
Can you just clarify, am I being asked about the opinion, should people be vaccinated or not, or what is the...
It appears to be that, which I think is a very controversial, it's a very divisive issue, but there are some other questions in, but they're submitting them, and so I don't see them. If you would be around later to answer those, they're being put in. But anyway, we thank you so much for your contribution today.
Thank you.